What is first aid?
First aid is the provision of initial care for an illness or injury. It is usually performed by a lay person to a sick or injured patient until definitive medical treatment can be accessed. What are the common emergency cases? Shock, poisoning, burn, wound. But now we will going to focus on wound.
What is wound?
Wounds is a break in the continuity of the tissue of the body, either internal or external. There are two classifications of wounds: closed wound, open wound. Closed wounds break in the continuity of the body tissue without the skin being broken down. It causes blunt object resulting contusion or bruises, application of external forces. Open wounds is an injury involving an external or internal break in body tissue, usually involving the skin. Classification: puncture, wound caused by sharp and pointed object penetrating the skin. Abrasion, caused by rubbing, scraping of the skin against rough surfaces. Laceration, the skin is torn by sharp objects with irregular edges. Avulsion, tissues are forcefully separated from the body. Incision, skin and tissues are cut by a sharp-bladed instrument. First aid management for open wound: inspect the wound if the bleeding does not stop or there's a foreign object is lodged in the wound. You might call for emergency services such as 911. But if the bleeding has stopped and the wound is free from dirt or any foreign object, here's what you can do. If the wound was contaminated with dirt, rinse it with running water. You may also use alcohol-free wipes to clean out dirt. Put a direct pressure to the pressure point with a clean gauze swab. Do the pressure bandage to cover the wound with a sterile gauze. Elevate the wound above the heart level. Bear in mind, these are the vital things you can do to wounded person. Control bleeding. It is imperative to stop the bleeding. If it doesn't stop, call emergency services. Minimize infection. Rinse the wound. Ensure that its sides are kept clean. Always cover the wound with a gauze to help in the healing process.